Thank you for staying with us. You know, tomorrow, Roper St. Francis is sponsoring a Bone Marrow Drive. This event will help match patients to a donor and give that patient a second chance at life. And we're going to tell you today how you can participate in this Bone Marrow Drive and also be a part of the Bone Marrow Registry. Dr. George Geils Jr. joins me now to tell us more about this. Great to see you, Dr. Geils.
Thank you.
First of all, tell me why it's important that people become a part of the Bone Marrow Registry and what purpose the registry serves.
Well, we desperately need people to volunteer to donate. You know, with the declining family size, there's a critical need for donors. Your average family size, given that there's only a 1 in 4 chance that a given brother or sister would be a match, there's only about a 30% chance that you will have a match within your family. And so if you need a bone marrow transplant as your only chance of cure, you have to go outside the family. And we use registries such as the National Marrow Donor Program, so-called Be the Match program that we have, to see if there may be a donor among unrelated individuals that nonetheless share enough of the genetics with the patient to be a suitable donor.
That's probably surprising to a lot of people. You would automatically think that if you are related, that you would likely be able to help someone in your family if there's a medical challenge of some kind, and that simply is not the case. It's not a guarantee.
And even with the unrelated donor, less than 44% of patients between family members and unrelated donors will end up having a bone marrow transplant.
Let's talk about how simple the process is to determine who can be a part of the registry. First of all, there are some people who are not suitable to be a part of the registry.
Correct.
And who are those people?
Well, the criteria include anyone from ages 18 to 60. You have to be generally healthy. Obviously, you don't want to have some communicable illness that you could donate, in essence, to the patient. But most people who are generally healthy can donate.
Okay, and also the process that will happen tomorrow. You're going to be there for a great part of the day, but it really only takes about 10 minutes to be a part of the National Registry.
Absolutely. You sign a consent form. We take a little plastic brush and swab the inside of your cheek. It's painless. You don't even have to get stuck with a needle to see if you can be a donor. That's
amazing. I mean, all it is just a mouth swab, and that's it. And if you are found to be a match, what would happen next in that process?
Well, you know, there are 7 million people who have signed up, and yet only 35,000 donors since the institution of the National Marrow Donor Program have ever actually donated. So admittedly, the likelihood you'll be called up is very small. But I think that the greatest hindrance to people volunteering to be tested is the concern about pain. And if there's one thing I can tell you, it isn't painful.
No part of the process actually is painful, even from the swab to someone actually making the donation. It's really just as simple as giving blood. It's pretty much the same kind of process.
It doesn't hurt me a bit, but no. Actually, more often than not, we're actually collecting blood stem cells. We don't go to the operating room for the majority of patients, majority of donors, and even if they are, they're asleep. So they don't feel discomfort. For those who donate bone marrow, you are sore for a few days, maybe a week, but it isn't terrible soreness. Uniformly, donors say that they're not as sore as they thought they would be. More often than not, we're collecting stem cells from the blood. So you're sitting in a lazy boy watching television, quite comfortable in donating really life-saving organ.
Quite comfortable and saving a life. Doesn't get any simpler than that. Dr. Geils, thank you very much.
Thank
you. Appreciate that. I look forward to seeing you tomorrow as I become a part of the registry. And we remind you that tomorrow, Friday, the 25th, from 7:30 until 5 o'clock in the afternoon at Roper Hospital, this is downtown Charleston, Calhoun Street, you can become a part of the National Bone Marrow Registry by going in and making sure that you're swabbed and give them your information. Stay with us. We're coming right back with more news right after this break.